release I was looking for. And the ligaments they'll clunk or click when you feel them release. Those really loud releases are kind of alarming, but they do happen. And there will be clients, I'm going to deviate just a minute. There will be clients that have enough musculature in their lower leg where you can do forearm work. Because you're probably all realizing I'm using a lot of fingers. I do that in part because I have large hands and I'm working a small area. So to get the access and the definition I want, I do a lot of fingertip work on the feet. But if you've got small hands or you're small framed, work up to your elbow. If you've got this good and warmed up and you know there's adhesions in there but they're kind of loose, get down to the elbow and just run it up there. Don't put your whole body into it. You might have to scrape them off the ceiling, but...
You can show that. Just trying to help out.
I'm not going to use a lot of pressure because she knows my body weight's not inconsiderable. But you can come up to your elbow and be careful not to use the point because this is a belly of a muscle and you can bruise it if you've got a pointy elbow and you go in there on the point. So what I'm going to do is there's a flat spot right before your point. Yeah. And you just want to iron it lightly. And it's a nice way to get a tool on that muscle that's the size of the muscle. And you want to loosen your pressure up too around the knee because when you get past here, you're starting to get into tendons and ligaments. They don't have the blood supply, and they're not real wild about being manhandled.
That's releasing all the way up to my low back.
Yay! Okay, you guys know why it's releasing all the way up to her low back?
Because of the muscle connection.
And fascia.
Fascia.
Fascia's always talking to each other all the time all over the body. So that's why sometimes you'll be working in one area when you've been someplace else and it's like, okay, I know that was still there, and the release will come when you're working somewhere else. And it's because the release came through the fascia.
Would you ever have the client lowered and you sitting on a stool, or no?
Lower to me sitting on the stool. Do you mean them on the floor or
No, just
on
a
a lower
lower table, or just
Yeah.
to get a better angle, or
Yeah. Because during a full body, this table's, I mean, you guys see where this table's hitting me. This table's way too high for me to work on. And that's why I'm standing. But usually during footwork, I'm sitting. It's one of the spots, foot and head and neck work, I tend to sit during a full body. And if I get to spend time with hands, arms, I tend to sit there too. Because for one thing, you don't generally need your whole body's mechanics and your whole body's weight to work limbs. And I can really sit down and focus on, all the ligaments and tendons and all the phalangeal joints in the feet that way too.
Do you think there's anything you can put into words about how you listen with your hands?
This was my first challenge in massage school, is how to verbalize things that I'm doing. Have any of you noticed yet that the sensitivity in your fingers has gone up?
Yes.
yeah.
I mean, you're sorting laundry the right way without looking at where the seam's running and all that kind of stuff.
Mm-hmm.
These are big ears for a massage therapist. 10 of them. Plus 12 when you pull the palms into it. And when you start projecting too, down your arm up to your elbow, this gets to be one big old radar sensory array. And I get more information from that during a session than by doing anything else. You get texture of skin, what's thick where, what's congested, what's a knot, what's sensitive. I generally on clients can find bruises before they start showing. Just because you're getting so sensitive to the texture of the tissue. Especially when you've got clients you see, you really can chart changes for them over time. They'll start storing tension in different places, or they'll have it's like, okay, what's going on the last week, because you never had knots here before. And can help them kind of be aware of what's going on in their lives. But I don't know how many of you have read Oliver Sacks. He is a physician who studies the senses primarily, and mental health and some other things. And he talks about tasting music and hearing scents, hearing color, those kinds of things. As you progress in body work, you'll start getting your head wrapped around like, but that's what it really is. It feels like I'm listening, but it's touch. And our brains, it's kind of funny to get your brain turned off too, because I'm pretty academic in terms of what I came to the program for. But you've got to learn to let your brain get out of the way, because your brain wants to be in the business of everything you're doing. And your hands, once you start getting these skills into your hands and your toolbox, your hands know what they're up to. They don't need your brain to call judgment on it and say, yeah, you can do that or not. They'll just do it.
Do you feel a lot of energy in the feet? Like transfer to you?
Yeah. And the feet can tell you where in the body there's anxiety or worry or buildup, or what's really happy. Sometimes okay, I hear you, I get it, but I need, so-and-so needs a little attention now. So can you be patient enough for me to talk to them, and then we'll come back.
How do you deal with someone with like screws in their feet, or they couldn't rotate it at all?
You work gently, you don't stretch that. There's still a lot you can do if you're working lightly, like if you were doing manual lymphatic drainage almost, just a light touch. Even that still helps move fluid and keep nerves working well and capillaries working well. And again, I tend to cradle the ankle on the outside. And part of that is just how many meridians you can contact that way. And part of it is physically, it's a really nice cradle for the heel. The heel's a great cradle for the foot. It's kind of my anchor point for that. And when I'm just working feet, I say goodbye in stages. I think anything done to the body suddenly is kind of an alerting thing. And I don't want to get somebody good and relaxed and get everything nice and soft and get everything buttery from the knees down and then go, oh, bye, I'm out of here. They may have to go back to a job that drives them crazy in the next 30 minutes, but I don't have to do it while they're on the table.
Do you use less pressure when you work around the knee?
Do I use what?
Less pressure.
Less pressure.
Generally, yes, because I don't want to prang. Our knees take a good bit of abuse anyway, and there's not great blood supply because it's mostly ligaments and tendons. So yeah, I do tend to work more gently around the knee. Thank you, Zephyr.
Thank you.
Questions, comments, concerns?
You had one move that I found myself locked into. And then again, I saw it on the other